From our studios in Olympia, Washington, TCTV presents South Sound Seniors, news and views featuring the people, places, and events that impact our growing senior community here in the South Sound region. Our program is presented as a community service to inform and involve you and yours in the lives of older adults. Your host for South Sound Seniors is the Executive Director of Senior Services for South Sound, Eileen Mackenzie Sullivan.
Welcome to South Sound Seniors, a program for and about older adults in our community. I'm just really thrilled about the show that we're having tonight, but first I want to thank the folks here at TCTV that make it possible. Well, tonight is one of our shows that we share with somebody from the Senior Action Network. So periodically, SAN, I think it's every other month, comes and sends one of their members to help us educate seniors about something that's really important to them.
Our guest for this edition is Matt Patton of Cascade Mental Health.
And what do you do for Cascade?
I'm the clinical director at Cascade, so I oversee all aspects of our clinical services at the agency.
Okay. And tell me a little bit generally what Cascade Mental Health does.
We are the primary provider of low-income mental health services in Lewis County.
Okay.
We're kind of the equivalent of behavioral health resources here in Thurston County.
Uh-huh.
So we're a comprehensive program. We have children's services, we have medical services, co-occurring disorders, people with drug and alcohol issues, outpatient, just counseling programs, community support programs, small residential, a kind of crisis program.
Wow.
And then also our geriatric program.
Okay, and that's primarily what we're going to talk a little bit about tonight. Yeah, because I know working with seniors, we often do come across a real need for some mental health professionals to intervene and help us in caring for and working with some of our seniors. So it's, I think, really great that you were able to come up from Lewis County.
I'm happy to be here.
Yeah, thank you. Well, first of all, I know that seniors get really upset when they get confused and forgetful about things. So what is your concern if somebody comes in and says, I'm getting confused, maybe I'm hallucinating, or you hear this from their spouse?
Mm-hmm. Well, and part of that is, you know, there's a lot of things that can go into that. In terms of if somebody is getting really confused and maybe even to the point of hallucinating, and last week they were okay and now they're not, one of the first things that we'd think about is that the person may have some type of a delirium. There's a lot of causes for this, and it's usually something that is pretty simple. It might be, they might have a urinary tract infection. It may be that the person maybe they've started some new medications and there's been some interaction with other medications they were on, and they're having a bad situation, a reaction to that. Sometimes it can be just some metabolic issues that they're going through. And so usually one of the first things is, it's good that you're talking about that. Let's make sure that we've got a good relationship, that you've got a good relationship with your primary care physician. Let's go and talk to them about what's maybe going on. Let's test to see if you've got some type of infection that may be causing that. Did you in fact start some medications, and maybe that's the wrong one for you to be on. So don't kind of overblow the situation, and don't think it's kind of the end of the world, or I've got Alzheimer's or something that really is maybe a pretty common situation and something that we really just need to get a pretty good handle on. And usually when you deal with those situations, that confusion, those hallucinations will really kind of clear up fairly quickly.
So especially, as you said, if it's a sudden onset. Last week they were okay and now they're really having problems.
Yeah, if the confusion comes on more slowly, there may be some other issues associated with that. Sometimes people think of, they may think that they have dementia or something, if they're not remembering things like they used to, and that's also what I want to caution against, because it's something that's so scary, and it's one of those things that if I'm having those symptoms even, I don't want to talk to other people about it because then, that how are they going to treat me, and they will take away my independence or something like that. But a lot of times, the seniors, same with other people, one of the primary causes of forgetfulness are things like stress.
Oh, really?
I've got all kinds of things going on in my life, and things are kind of confusing, and I'm getting a little bit stressed about that, and I may tend to forget little details here and there. Another thing that sometimes happens is person may be experiencing some signs of depression. Some symptoms of depression can include confusion.
Yeah, so many seniors have losses that kind of pile up on them. It could be easy to get to that.
Yeah, and unfortunately, there's also the view in society, and so many people just think, well, that's just part of getting old. That it's just something I have to live with.
Yeah.
And not understanding that there can be treatment for that, and that they can get over some of those symptoms that are so scary.
Matt, do you think that some people also just kind of grew up in a time where you just don't admit you're depressed? You know, just stiff upper lip. Get through it. You'll soldier through.
Pick yourself up by your bootstraps.
Yeah. Right.
Yeah. They really do, and that's one of the things. In my agency, we have 3 geriatric clinicians, and a big part of what they do is they do some outreach work, some education. They may do some services directly in individuals' homes, but also go into like skilled nursing facilities, those kinds of things, and just educate people about mental health. Please understand that one of the worst things you can do is isolate yourself, and especially like around depression. If you're isolating yourself, you're going to tend to deepen the depression and make it a little bit stronger by isolating. And so one of the best things you can do is engage with others. Tell them what's going on with you, seek their assistance, and get involved with them in that way.
There's still some of that stigma. Oh, they might think I'm crazy if I, start talking about that.
Yeah, and I wish I had the magic cure for that. Sometimes, we'll have a clinician will do a couple outreach appointments, and they'll see somebody the first time. No, I don't need counseling. I don't need mental health. And then they'll come back again, and I don't think I need counseling. Come back a third time. I don't want to see a counselor, but it's okay if I see you.
Yeah.
You're kind of nice.
The relationship is there. Then,
you start to establish that, and that can. So sometimes we just need to be persistent.
Yeah, it's nice. It's hard to sometimes have the time to be able to do that, to get over some of those barriers, though, I imagine.
Yeah.
Yeah.
And again, it's difficult if that person has chosen not to engage with family or other senior providers or something. Sometimes it's how do we locate those individuals, because we can't just go around knocking on doors and saying, do you have a mental health problem?
Yeah.
And so it usually they've been brought to our attention through some other avenue.
Where do you get some of your referrals from?
A lot of locations. Primary care physicians is a big source, obviously.
That's good.
And yeah, it's important. I'd say one of the most important relationships a senior can have is the relationship with their doctor, and making sure that that's a good relationship, that you really have a doctor that you can talk to and feel like you can trust. And so I really encourage those kinds of relationships. We get a lot of referrals through the senior provider networks, the Area Agency on Aging, skilled nursing facilities, senior information and assistance. So a lot of those organizations that are already serving seniors. And then we also get a lot of referrals from family members.
Oh, that's good.
My mom just doesn't seem to be doing as well as she used to. Wondering if I can bring her in and we can talk to somebody. So sometimes those kinds of things too.
Yeah.
Usually when people have good family like that, they're way ahead of the game. So
yeah.
Yeah.
So back to the depression, because I know I remember hearing a statistic about older adults, and in particular older men, often suffering from depression, especially as they go from full-time employment or whatever, and then they retire, boom, they don't have a plan, they just don't feel like they've got much worth anymore.
Yeah.
How do you help somebody like that?
Well, I think one of the first things is to make sure that we've correctly identified the problem. And so we have to ask the right questions, ask about Are you having problems with your appetite? Are you having problems with sleeping? Are you having problems with feeling hopeless? Sometimes you might feel suicidal. Have you kind of lost interest in everyday activities, the things that used to be fun that you just don't seem to enjoy anymore? Are you isolating and away from kind of people that you maybe have connections with? So if you can identify that and identify the specific problems that an individual may be encountering, that's kind of one of the biggest barriers to effective treatment. And so part of depression and treatment for depression, there are medications that do that, but also just therapy. Cognitive behavioral therapy is very effective with depression. And so it can be as simple as helping an individual reestablish some of those connections and reestablish plans for, I used to go to work and that kind of occupied all my day. Well, let's develop a plan. What are you going to do to occupy your day? What are you going to do to feel useful to society? And maybe it's volunteering somewhere. Maybe it's just spending some time with a group of friends or developing some new hobbies. So there's a lot of things that a person can do to kind of combat that depression.
So there's hope. I think that's the main thing people really need to know.
Depression's very curable, and so people, it's not something you need to live with. Go get treatment and move forward with your life.
Yeah. Wow. So with your team that you have down in Lewis County, the geriatric folks, do they do some organized programs and outreach and education? Like, I'm senior center and it's always on my mind because that's where my office is. Do they ever go out to senior centers to help do education and warning signs, things to look at?
Yeah, they do. And a lot of that is just as individuals or these organizations come up and say, hey, we'd like to learn more about some specific topic, that our staff are very well qualified to go out and do that type of education. So it's one of the things I wish we could do more of, because I think so much in terms of ultimately having effective treatment has to do with early recognition. And so the more people that understand, some of the symptoms of a mental health problem, the better off we are, because we can just really then get involved in treatment a lot more quickly.
What, when somebody says mental health to me, I have a brother who has schizophrenia. So I think about, kind of the more intense diagnosis like schizophrenia and bipolar and that kind of thing. Do you see many seniors with those concerns and issues?
Certainly. So, in terms of schizophrenia and bipolar disorder are not mental health diagnoses that go away. As a person ages, those diagnoses don't go away, and treatment for them generally is considered to be something that is helping them maintain in their life and recover in somewhat, but the mental health symptoms themselves will not go away. You can treat them, but ultimately the disorder is still there, as opposed to something like the depression, that you treat the depression and then the depression's gone. Schizophrenia and bipolar disorder will still be with the person, and so kind of a commitment to ongoing treatment for the rest of that person's life is really kind of very important as far as those diagnoses go.
Okay. Wow. So to me, it's like a lifeline. If, so many times I've seen seniors that, maybe were in denial that they were having a problem with depression or memory loss or what have you. And it's sometimes just really hard to move them in that positive direction. Is there anything you would tell, like, somebody that works with seniors, not in the mental health field, but somebody like myself or my staff, what would be the best thing to do if you found somebody that there were some red flags and you really felt needed some help with mental health issues?
Well, I think one of the best things is, again, since there's the kind of stigma and a little bit of fear about mental health treatment, if you can say somehow, let me go with you to that first appointment. And mental health counselors, we'd love to have other people involved in that person's treatment. So if you could bring them to that first appointment and kind of help them establish a connection with that mental health counselor. That would be a terrific way to do that. And again, just making sure that they understand, you're not alone. You know that there are other people, even in this group that we have here, that have had mental health problems, that have mental health problems. And so trying to normalize that as much as you possibly can. It is not a rare disorder. Depression, mental health symptoms, mental health disorders are very common. And so making sure that they understand that, you're going through a rough patch here, and we can kind of find the right treatment, and we can get you back to where you have been before. That's kind of the key to really getting good treatment.
Okay, now I've got to ask the $24,000 question for your clients. I know you work with a lot of low-income clients that are probably funded. What if somebody didn't have public support, but were looking to pay for services privately? Is that still possible?
Yes, it is. And I think that most of the community mental health centers have like sliding fees.
Okay.
And so there's ways to kind of minimize the cost there. And then there are times when we can get real creative too with funding. We have some special grants that can pay for treatment for seniors, as opposed to, because maybe a senior isn't on Medicaid, that we can fund that treatment with different grants. And make sure that don't let finances get in the way. Yeah, contact the mental health center and say, what can we arrange here?
Okay, so if you live in maybe the Lewis County, or if you live in the south part of Thurston County and orient to Lewis County, who would they call? How would they get a hold of your geriatric counselors?
Yeah, and Cascade, our phone number is in the phone book, Cascade Mental Health Care. And so they can just give us a call and say, I'd like to request services, and we can kind of begin from there. And if for some reason, we are primarily Lewis County, so if for some reason they're not going to work out there, we would make sure that we got them in the right direction, who they needed to contact, in whatever county they were in.
Yeah, and like you said earlier, here in Thurston, most parts it's behavioral health resources that's also in the phone book.
Yeah.
Well, thank you. I think I would come and talk to you, Matt. You're a really nice guy.
Well, I'd talk to you anytime too.
All right. Well, thank you so much for coming in. I really appreciate it.
Yeah, you're welcome.
In case you hadn't noticed, there's a great energy at work here in the South Sound. It's called SAN, the Senior Action Network. And the name says it all. The collective knowledge, experience, and commitment of dozens of organizations and service providers represents an invaluable resource for older adults and their families. Truly, SAN is there when you need to reach out. Find out more, visit their website, or call us at 586-6181 and get on board as we celebrate live.